Hi, I'm Megan, and this presentation will focus on the strategies and techniques of calming an individual with schizophrenia without the use of medications or restraints. According to Chien, Leung, Yeung, and Wong, 2013, schizophrenia is a disabling psychiatric illness associated with disruptions in cognition, emotion, and psychosocial and occupational functioning. When somebody with schizophrenia is not acting or functioning the way that nursing staff deem appropriate, it is very easy to turn to medications or restraints. However, this is not the answer. The answer is to provide a safe environment or milieu for the patient. Promote good conversation and communication to lower anxiety, decrease defensive patterns, and encourage participation. According to Sommer, Johnson, Roberts, Redding, Churchill, Henry, and McMichael, 2013, it is also okay to ask the client directly about the hallucinations. You shouldn't argue or agree with the hallucinations, but instead say things like, "I don't hear anything, but you seem to be feeling frightened." Also, give reasonable explanations for the delusions. An example of that would be, "I can't imagine the President of the United States would have a reason to kill a citizen, but it might be frightening for you to believe that." Another great way to distract from voices is to provide music therapy and having the client walk. These are great ways to just distract from the voices and help calm the schizophrenic patient. It is also very important to avoid the triggers. Defining the triggers of the schizophrenic patient is crucial so that they can be avoided. These triggers would be examples like loud noises, uniformed personnel, slamming doors, etc., etc. Anything that might set the schizophrenic patient off and send them into a manic episode. Chien et al. 2013 provide 5 categories of psychosocial intervention. The 5 categories are cognitive therapy, psychoeducation programs, family intervention, social skills, training programs, and case management or assertive community treatment. All of these strategies and techniques gain the trust and respect of the schizophrenic patient, providing a nurse-patient relationship. In this relationship, the schizophrenic patient can turn to the nurse when they are having hallucinations or voices, and they can find a way to decrease them before the illness escalates. King and Nazareth, 1996, discussed community mental health teams. Psychiatrists, psychologists, community psychiatric nurses, social workers, and other professionals work closely together in teams in the community. These teams go to the patient's home. Home visits enable assessment and treatment in the context of the patient's family. This is a great way for the nurse and patient to learn and trust more about each other. I have hit a few key strategies and techniques for ways of calming the schizophrenic patient without the use of medications and restraints. I have also included a list of my references that I used.